Radiology in a Minute Research Summarized. Right ventricular strain improves cardiac MRI-based prognostication in heart failure with preserved ejection fraction. The purpose of the study was to determine the associations between right ventricular strain derived from cardiac MRI feature tracking and adverse outcomes in patients with heart failure with preserved ejection fraction HFpEF. This is a single-center retrospective study of 1,019 HFpEF patients in the development cohort and 273 in the validation cohort, all underwent cardiac MRI. The primary and secondary endpoints were all-cause and cardiovascular death, respectively. Key results: in follow-up, patients reached the primary endpoint had a significantly more impaired left ventricular global longitudinal strain and greater impairments in right ventricular longitudinal and circumferential strain, as we can appreciate in the representative patients shown here. Cox regression showed right ventricular longitudinal and circumferential strain independently predicted both primary and secondary endpoints, unlike left ventricular global longitudinal strain and right ventricular ejection fraction. Kaplan-Meier analysis showed right ventricular strain independently predicted adverse outcomes and provided greater prognostic values than traditional clinical and imaging-derived risk markers in HFpEF patients. In comparison of the performance of different models, the addition of late enhancement and right ventricle strain to the baseline model with only clinical variables significantly improved the prediction accuracy of primary endpoint. Right ventricular longitudinal and circumferential strain independently predicted all-cause mortality even after adjusting for T1 mapping data. To summarize, MRI-derived right ventricular global longitudinal and circumferential strain independently predicts adverse outcomes in heart failure patients with preserved ejection fraction, highlighting the prognostic value of right ventricular dysfunction and the importance of assessing biventricular function in management of these patients.